Ever wondered how total hip replacement surgery works? It's a fascinating medical procedure that has given many people a new lease on life. Essentially, it's the process of replacing a damaged or worn-out hip joint with an artificial one. This artificial joint, often made of metal and plastic components, acts as a new hip, allowing patients to move around more freely and without pain. Now you might be wondering, who typically needs this procedure? Well, it's often recommended for individuals who experience chronic hip pain that impacts their daily life and doesn't improve with other treatments. This could be due to conditions like osteoarthritis, rheumatoid arthritis, bone tumors, or injuries. Total hip replacement surgery can be a game changer, significantly improving the quality of life for many patients. So if hip pain is hampering your daily activities, this procedure might just be the solution you're looking for. Join us as we delve into the details of this life-changing procedure. The total hip replacement surgery is a meticulous process. Let's break it down. The journey to a pain-free life begins with an incision made by the surgeon to access the hip joint. This is the first step in our detailed process. This incision is crucial as it paves the way for the surgeon to reach the damaged bone and cartilage that have been causing discomfort and reduced mobility. Once the hip joint is accessed, the surgeon proceeds to remove the damaged bone and cartilage. This is a critical step in the surgery, as it is here that the root cause of the pain is addressed. The surgeon meticulously removes these damaged parts to make way for the new artificial components that will take their place. With the damaged parts removed, it's time for the artificial components to be implanted. These components, which include a metal socket and a ceramic or metal ball, are designed to mimic the natural movement of the hip joint. They are securely implanted in the hip joint, a testament to the marvels of medical engineering. The final step in the surgical process is the closure of the incision. This is done with care and precision, ensuring that the new joint is secure and the patient is ready for the recovery journey. The entire process of a total hip replacement surgery, from incision to implantation, is a testament to the advancements in modern medicine. Each step is meticulously planned and executed with the aim of restoring mobility and alleviating pain. But remember, the surgery is just one part of the journey. After the procedure, the patient embarks on a path of recovery and rehabilitation. It's during this phase that the benefits of the surgery truly come to fruition. With dedicated physical therapy and lifestyle modifications, patients can experience a significant reduction in pain and an enhancement in their quality of life. It's a precise process aimed at alleviating the pain and enhancing the mobility of the patient. Like any surgery, total hip replacement surgery carries certain risks. It's important to be aware of these, as knowledge is power when it comes to your health. Now, let's delve into the potential complications that can arise. Firstly, there's the risk of infection. While surgeons take thorough precautions to prevent this, sometimes bacteria can enter the body during surgery and lead to an infection. This can usually be treated with antibiotics, but in some cases, additional surgery may be needed to remove the infected tissue or replace the artificial hip. Secondly, blood clots can form in the veins of the leg after hip surgery, known as deep vein thrombosis. These clots can occasionally travel to the lungs, causing a potentially life-threatening condition called pulmonary embolism. To minimize this risk, doctors often prescribe blood-thinning medication and encourage early mobilization after surgery. Nerve damage is another possible complication. During surgery, nerves near the hip may be injured, leading to numbness, weakness, or even paralysis in the affected area. This is usually temporary and resolves over time as the nerves heal. Lastly, dislocation of the new joint may occur. This means the ball of the prosthesis comes out of its socket. Certain movements or positions can put excessive strain on the new hip joint and cause dislocation. If this happens, the hip needs to be put back in place, sometimes requiring surgery. While these risks might sound alarming, remember that they are relatively rare, and your surgical team will take every precaution to prevent them. Moreover, with proper medical care and rehabilitation, these risks can be significantly minimized. So, while it's natural to feel a bit apprehensive, don't let fear hold you back. Talk to your doctor, ask questions, and understand all aspects of the procedure. Remember, the goal of total hip replacement surgery is to help you live a pain-free life, and that's a goal worth pursuing. While risks are present, they are manageable with the right medical attention and care. It's all about being well-informed and taking the necessary precautions to ensure a successful recovery. What does life look like after total hip replacement surgery, one might wonder? Well, The transformative power of this procedure is often life-changing for many. Once the initial healing period has passed, most patients begin to notice a dramatic decrease in their pain levels. The constant nagging discomfort that once dominated their lives is replaced with a newfound ease of movement. The simple pleasures of life, like taking a leisurely walk or getting out of a chair without wincing, become attainable once again. But the benefits of total hip replacement surgery go beyond just reducing pain. The procedure also often leads to increased mobility. As the new artificial hip joint starts to feel more natural, patients typically find that they can move with greater flexibility and freedom. This increased mobility can open up a world of possibilities, from returning to beloved hobbies to simply being more active in day-to-day life. However, it's important to remember that achieving these improvements requires dedication to post-operative exercises and lifestyle modifications. After surgery, patients typically undergo a course of physical therapy to strengthen the muscles around the new hip joint and to improve balance. These exercises not only aid in recovery but also help to maximize the function of the new hip joint. In addition to physical therapy, adopting a healthy lifestyle is also crucial. This might include maintaining a healthy weight to reduce strain on the new joint, eating a balanced diet to promote healing, and avoiding high-impact activities that could damage the new hip. But the effort put into recovery is often well worth it. With dedication and commitment, patients can return to activities they once enjoyed. They can rediscover the joy of movement without the constant shadow of hip pain, and that in itself can be a powerful motivator during the recovery process. So what does life look like after total hip replacement surgery? For many, it looks brighter, fuller, and filled with possibilities that seemed out of reach before. With dedication and commitment, patients can return to activities they once enjoyed. How does a replacement hip compare to an original hip? This is a question that many individuals considering total hip replacement surgery might ask. Let's delve into the details to paint a clearer picture. The original hip joint, or the natural hip, is a complex structure. It's a ball and socket joint where the ball at the top of your thigh bone, or femur, fits into a rounded socket in your pelvis. This structure allows for a wide range of motion, from walking and running to squatting and jumping. The joint is also cushioned by a layer of cartilage, providing smooth, pain-free movement. Now let's contrast this with a replacement hip. In total hip replacement surgery, the damaged or worn-out parts of your natural hip are replaced with artificial components. The ball of the femur is replaced with a metal or ceramic ball attached to a metal stem. This fits into a metal socket that's implanted in your pelvis. Just as in the natural hip, this ball and socket design allows for movement. While the replacement hip is designed to mimic the function of the natural hip, there might be some minor differences. For instance, you might find that your range of motion is slightly different after surgery. However, most people find that they can return to their regular activities and even take up new ones after they've recovered. It's also important to note that while a replacement hip doesn't wear out in the same way a natural hip does, it's not completely immune to wear and tear. That said, with today's advanced materials and designs, replacement hips can last for many years, often decades. So, in comparing an original hip to a replacement hip, we find that while they have their differences, the aim is the same: to provide a pain-free, mobile life. While there may be slight differences, the advantages of a pain-free life make it worth it. Total hip replacement surgery offers a promising solution for those suffering from hip pain. We've taken you on a journey through the process, from the initial incision to the final steps of recovery. We've examined the potential risks, but also highlighted the transformative results that can follow. This procedure, while complex, aims to mimic the natural hip joint, and though there may be some minor adjustments, the benefits are substantial. Reduced pain, increased mobility, and an overall improved quality of life are just some of the outcomes many patients experience post-surgery. However, remember, this is a decision not to be taken lightly. It's crucial to have open and thorough discussions with your healthcare provider. Weigh the pros and cons, understand the possible complications, and consider the commitment to post-operative care and lifestyle modifications. A pain-free future could be just a surgery away. Consult with your healthcare provider to explore your options.